evening, everybody. Thank you so much for choosing to spend your evening with me here tonight. I've got lots of golden nuggets for you of information, so I'm sure you'll enjoy that. I'd also like to start off by thanking Dentsply Sirona for inviting me here to speak, and also to Dental Update for hosting this platform. So before I start, I just want to give you a little bit of background on myself. So my name's Dr. Bhavna Doshi. I am a dentist. I've worked predominantly in the industry with my husband, Rahul Doshi, for the last 30 years. And we've kind of done most ventures together. Sometimes he's in the forefront, sometimes I am. And we've done a whole host of, we've been heavily involved in the industry over the years. We've done speaking internationally. We've been heavily involved with the media. We've owned multiple practices ourselves. And also I've owned opticians practices, and also I've been in the pharmaceutical industry as well. We've done a lot of work on TV, like we've done all 3 seasons of Extreme Makeover. And also, we've been judges for the National Private Dentistry Awards for the last 15 years or so. We've also had the Perfect Smile Advanced Training Institute, where we used to run clinical hands-on courses. And so, you know, we've got quite a lot under our belt. So now what we do is, so Rahul is clinical director for Dentex, which is a corporate, I believe it's about 150 practices they have now. And I predominantly do business coaching with my company Dental Wealth Builder, or DWB for short. And I am a profit strategist, and my area of expertise is how to gain case acceptances for high value treatment plans. And my mission now is really to empower teams, inspire teams, and help transformations. I work with associate dentists. I have all sorts of programs for that. And I work with dental practices. So what I also have is quite a few statistics that where people have gained exponential growth. As a minimum, I'll be able to get at least 20 to 30% increase in your turnover. So tonight, I'm quite excited here, but I'm excited and I'm like, pushed for time as well, because I'm trying to get quite a bit that I would cover in a whole year in this 1 hour. So if anybody has any questions, or, I encourage you to put them in the chat box there. If I don't manage to get to answer your questions, then you're more than welcome to follow me on Instagram and DM me there. So that'd be really good. So today, I'm talking about how to increase your case acceptances for clear aligner treatments. Now, I've kind of done this in a way that, that can take you stepwise through the whole process to give you like the big picture. So the first aspect is we have to understand our patient expectations and be able to meet those expectations, if not exceed them. The second aspect is to develop enhanced communication capabilities. And then the third aspect is developing a sales process. So I'm going to talk you through all that tonight. So the first aspect is understanding your patient expectations. Now, all patient dissatisfaction, medico-legal cases, complaints, all this is related to unmet expectations. And we need to actually take the time to discover those patient expectations, because if we don't discover what the reason why they have actually come to us, then we're sort of onto a non-starter, and there can be all sorts of assumptions made, and we won't be resonating with what our patients are actually looking for. So we have to take the time to understand exactly why they are there, and what I call psychological pain is, and what the reason is that they're actually there for us. You see, these days, if we look, there's just way too much information. patients are finding it difficult because there's so many providers, so many people saying we do, short-term adult orthodontics, so many people claiming to be the best. And the thing is, it's really difficult for patients because what do they choose? Which is the best option for them? If you think about this, like if we were choosing, say, accountants, how do you choose the best accountant for you? How do you know that they're going to be, supporting you and delivering the most optimal results for you? If you go to find surgeons, heart surgeons, or specialist doctors, how do you know? Everyone's claiming to say that they're qualified, that they've got lots of experience. So patients find it very difficult to differentiate practices and dentists. And we have to sort of acknowledge that, because that's what's going to help us to be able to better understand where our patients are coming from. So when it comes to patient expectations, it's literally understanding where they are actually coming from and what they're actually looking for. Because if you don't ask, you won't know. And all too often, what we tend to do is we tend to make these assumptions. Now, there is a term called choice architects, and it's used quite frequently in topic areas such as behavioral scientists and social psychologists. And what this term basically means is that they design a process that helps patients. It's used in consumer and retail as well, so helps consumers make better decisions for their health whilst maintaining their freedom of choice. So if we can become choice architects, then we can better understand what our patients want from us, and we can help our patients to be more informed about the choices that they're actually making. So if we're going to be choice architects, then we have to look at the buying decision. We have to look at the psychology behind sales and understand, how do people actually buy? How do they make purchasing decisions? And if we understand that and integrate those ideas and techniques into the process that we have in our dental practices, then we can go a long way to meeting those patient expectations. You see, most of the time, what dentists do and dental practices do is we focus on patient education. So we talk about, with clear aligners, it might be what clear aligners are, the benefits of them, the disadvantages of them, the protocols, the number of appointments, how much it's going to cost, what happens in each appointment. Now, all these things are logical. It's educating the patient, it's going through protocols, it's the science behind it, and it's very logical. However, there's another aspect to this, and that is what patients feel, how they come to understand things. And that's the patient experience that they have. Now, that is emotional. Now, the truth is, patients don't understand dentistry the way we would not understand what heart surgery is all about, and the nitty-gritty of the techniques and the real main stuff that goes on, or with accountants or with solicitors. We don't really understand what's actually going on, but what we do have is intuition, and we have a gut feeling of, this feels right. We've got vibes with them. And that is our experience. That's our emotions. And the truth is that people make decisions, especially purchasing decisions or important decisions, actually, based on emotions, because that's how we feel. We feel good in that situation, and therefore we're more likely to move forward with that situation. If we don't feel good, then we won't. So what we do now, I'm not saying that logic and patient education is not important, but what we do is we make the decision emotionally, and then we support that decision with the logic. And that's how most decisions are actually made. And the truth is, it's about what we value. And the thing is, we value what we want, not what we need. And there is a distinct difference between want and need. So let's explore that a little bit. So want is a feeling you have, and when you have it, you enjoy it. It's like a drug, it's an addiction. It stimulates all the serotonin and those receptors in our brains, and it makes us feel good. So we want to enjoy more of it. And it's the reason behind why we buy, like, I know for women, we buy so many handbags and or shoes and clothes. And how many of us have always looked in our wardrobe, and an important event is coming up, and we'll say to ourselves, oh, I've got nothing to wear. And that's not true. We have loads of clothes and things to wear, but we will say that because we want that feeling. We want to purchase something, or we want to feel special. We want that sort of kick again, and that high that we get. So we will then justify it logically that we need it because I need something to match this, or we'll justify it logically, but the actual decision will be made emotionally. Now, on the converse, if we look at need, and that feeling, that's not a feeling we like, because it's almost an inconvenience. So, for example, when you have to have your car serviced, or the roof is leaking, or the sterilizer doesn't work, or the compressor doesn't work, and we have to then get an engineer out. We have to pay for the engineer. We don't really enjoy that whole experience. No matter how good they are, we just don't enjoy it, and we don't want that feeling again. Now, the truth is that case acceptance occurs when patients want what they need, but they also support that with loads of value that they're actually getting. So we kind of have to hit that sweet spot. And the value I'm talking about is actually perceived value. It's never actually the value of the actual item itself. It's all about our perception. And our perception goes back to our intuition. And our intuition goes back to our emotions and how we are made to feel. So let's look at perceived value for a little while. If the perceived value that a patient experiences in our practice is similar to their expectations, so we've kind of met their expectations, they thought this is how it was going to be, and that's exactly how it turned out to be. Then, when you give them the fee, and especially these days with patients having researched on the internet, they know roughly what they're to expect. Then they will think that's a fair fee. I kind of expected it to be that. Now, if, however, we give them so much value, we build so much trust, there's just so much that suddenly patients can't compare our practice or the way we do things to another practice, that they feel, hang on, I'm getting something special here. My intuition is giving me all these positive vibes, that I trust these people. These people are going to do good by me. Then the perceived value is raised to such a level that then the fee becomes inconsequential. I'm not saying totally inconsequential, but it goes a long way towards the decision, the purchasing decision, and gaining case acceptances. The problem that I see mostly in most practices, and I've been doing now business coaching for 17 years, and I've seen loads of practices up and down the country. I've worked with loads of associates. The problem that I see is most of the time we don't even look at the perceived value. We almost work in our practices operationally. Now, operational systems are completely different to growth systems. So operational systems are those systems that you need in the practice to keep the practice open and running. Growth systems, however, are things that the more you work on growth systems, the more, like your sales, internal marketing, the more you're going to be flourishing. And when we only work on operational systems, the perceived value becomes so little. Although we might feel that we're doing the very best, our very best, because we haven't elevated ourselves to a different level in how we communicate, in how we actually do things, patients find it hard to differentiate us from other practices. And it almost becomes like if you went to your NHS GP practice, it's very clinical. It keeps people on the logical side of the brain, with patient education, with technical jargon, with, all the processes and protocols. And when that happens, then patients are, their logic, they're keeping the logic there. They're not in an emotional phase, and therefore they tend not to make the decisions that they want, that they should be making or that are in their best interest. So when perceived value is so low or next to nothing, or we are very similar to what they see other practices as, then cost always becomes an issue. And what we tend to do is we tend to say to ourselves, oh, that was too expensive for the patient. But we haven't really addressed the real issues there. And, we can actually fall into a pitfall if we do that. The truth is, we have to find what I call the hot button for our patients. That is the psychological pain that they have felt, the real true reason as to why they have come to us in the first place. And the truth is, when patients come to us, they don't go through all this journey of figuring out that they're in, that they need some help, that they need a solution. It might be that they've seen their teeth are crooked, or they've got gaps in their teeth, and they've seen photographs of themselves. And every time they see these kind of things, they get a sort of negative zap in their brain. And when that happens, it doesn't make them feel good. So eventually they decide to do something about it. And, in this day and age, people, have no time for anything. So if people take time out, and then because of your marketing or some aspect, they choose you and come to see you, they're not really looking to say no. In fact, if they have to say no to you once you presented your case, if they have to say no, they're the ones that are the most disappointed. And if they are disappointed and we haven't got a case acceptance, then we'll feel disappointed at the same time. And, it just doesn't work out that way. So it's really about upgrading yourself personally on all capabilities. So if we want to move forward in gaining case acceptances, and I'm talking about consistent results, regular, consistent, predictable results, then we have to do things a little bit differently. If we do the same old thinking, the same old way, we're just going to get the same results. So we need to sort of change things and shake things up a little bit to meet the new age, and the psychological age of how patients are actually, making these purchasing decisions, and seeing how we can actually meet those expectations. So once we've understood that and know that that's what we're trying to aim to increase that perceived value, another aspect that's equally as important is enhancing our communication capabilities. Now, effective and efficient communication is actually critical for the entire team. And we want to do impactful communication. Every time we speak to, whether it's to each other on the team or whether it's to patients, it needs to be impactful. Because if it's to each other, then we're coordinating ourselves to help our patients and to make the whole process and the journey really beneficial to everyone. And if it's to patients, then it's trying to understand where our patients are coming from, what their expectations are, why they've chosen us, and why are they here in the first place? What is it that they want us to fix? And the truth is, if we do not focus on how we communicate, and unfortunately, it isn't a thing that's actually taught at dental school, or, when we're very new to this, we at dental school, we're so focused on the logic aspect and the clinical aspect of it. We almost become brainwashed actually into thinking of things microscopically. And because we've not really done any communication learning, we kind of just talk, and we feel that just because we have said what we need to say the one time, that we've communicated. But the truth is that isn't really what communication is all about. And if we talk in that way, so if we only communicate that whatever we need to say once, and just say it without any true understanding, then there's a great risk of jumping to conclusions on both our part and the patient's part as well. And the patients might think that we're not the right dentist for them, and we might feel that the patient doesn't want this treatment, but they might want it because we haven't explored it further. And also all these assumptions that we make of whether the patient can afford it or not, or whether the patient wants something or not. And actually, the intended meanings get lost. So, we have to look at effective communication. um, if there is non-effective communication, then there's a lot of things that actually can fall into the mix that can make the situation worse. There's a lot of mistrust. When patients don't trust the practice they're with, they definitely won't go for case acceptance. They may feel that there's unmet needs there that we haven't explored, that maybe we have the solutions for. They might feel that there's low perceived value. And then the thing is, if we don't provide the patients with the right information through correct communication, then they have no choice but to differentiate us based on cost and based on the fees. So they will think in their mind that we are exactly the same as another dental practice, and therefore it's like for like. And the truth is, it's human nature, right? If we feel we're going to get exactly the same thing somewhere else as this, then why are we, be silly to actually pay any more for it? And that's when cost actually comes into the issue, because the perceived value is so minuscule, and we've just left the patient no choice but to make those judgments on fee alone. And then, because of these sort of assumptions and conclusions, we can fall into the trap of medico-legal issues and problems as well, which nobody really wants to go down that route. So effective communication techniques can actually help us to better understand our patients, to manage their expectations, to remove those obstacles that might be in their way to getting the correct treatment, and also helping to differentiate ourselves from other practices, so that patients choose us over other practices because we provide them with so much value. Now, when it comes to communication, the sort of foundation of communication is basically verbal and non-verbal communication. Verbal communication is using our voice, and how we use our voice. But non-verbal communication is our body language. And the thing is, these two things are actually combined, and they work together. So they're not differentiated, they're connected. And eventually, the stimulus that patients get through verbal and non-verbal cues is what makes up their intuition. Now, in this day and age, with the advent of the internet and the information on social media, and lots of information that patients have about clear aligners or about orthodontic treatments, the impact of our words are very important. So there is a certain level of logic and patient education that patients are looking for. However, having said that, the voice quality is more important, I feel. And the voice quality are things like, whether our voice is soft, the speed of our voice, whether we sound rushed. I mean, this is really important for when you're picking up the phone to new patients. If you're very busy in your practice, or your team are very busy, and they're doing several things all at once, which usually is the case, and when they pick the phone up, if they sound rushed on the phone, then patients are going to feel that this place does not have the time for me. And we are all looking for someone to give us that time, so that then we can talk to them about what we're actually looking for. All patients want to give us a total history of what they are looking for, because the more they talk, people feel. I mean, think about it. When you go to your GP, if you have a problem and you go to your GP, you want to talk, you want to tell them the history. And even with us being in the medical profession, we still want to talk, and we still want to say things. So can you imagine the ordinary layman person? They don't understand these medical terms and things, and they might have done research on the internet, but they still can't make head to tail out of it. So they want to talk. But if they feel that someone is rushed or not paying attention to them, because they might not have eye contact, or their body language is telling them that they are just a number, and that they're very busy and they haven't got time for us, then again, that sort of makes us retract ourselves. Things like a happy voice, or an administrative voice, all these things actually correlates to patient intuition. But the most important thing really is our non-verbal cues. And the thing is, this goes back to your mindset. If you are thinking in your mind that, oh, I'm rushed and, I don't like being here and I don't like doing this treatment and I've got a very difficult life. And if you're thinking all these negative things and you're not excited and passionate about what you're doing, then your non-verbal cues are going to say just as much. You won't be able to hide them. And we see this all the time. You can easily tell when someone's really passionate about what they're doing because they enjoy it, and someone who isn't. And let's face it, who would you rather be with? Who would you rather have treat you? Somebody who's really passionate and enthusiastic about the treatment, or somebody who's just it's just a day job for them, and they're just you're just another patient on the list. So non-verbal cues are really important, but it goes back to what you're thinking. So sometimes I think it goes back to having a clinical vision. If you've decided you want to do short-term adult orthodontics and you want to take up clear aligners or that sort of treatment, then have that clinical vision and make that decision, and and make sure you're sort of enjoying going down a path of treatment that you actually like. I remember when I was practicing dentistry, I don't no longer practice dentistry anymore. I haven't done so for a number of years, but when I was practicing dentistry, all I did was restorative work, like veneers. That's all I did. Day in and day out, I would do smile designs. And I enjoyed it. And I loved the results that I was actually getting. So I was into minimal prep veneers and the thin, ultra thin veneers. But I loved it. And that's what I wanted to do. So you need a clinical vision as well. When you're communicating with your patient, you need to use layman language. So don't try to avoid technical language. If you are going to use technical language because there's no other way of describing it, then use a layman language as well. So for instance, if I'm talking about fixed orthodontics, I will also say bracket and wire systems so that the patients can understand that these are the wire things I'm talking about, rather than just saying fixed orthodontics, because sometimes patients don't know what that actually means. I mean, they might know that it's fixed and they'll try to, but again, they're going down a path of making assumptions of what it is. And in good communication is all about clarity. People do not buy things they do not understand. So it's all about clarity. And then just be straightforward, in how you are. There's no tricks here. There's no gimmicks. There's no, magic happening here. You're just literally trying to understand and checking the understanding of your patients, with what they are saying. So really, a large part of communication, a huge component of it, is actually how we hear our patients, how we are listening to our patients. And there is a technique called active listening. I've been using this technique for years now, and I'm telling you, it literally transformed my life when I learned this technique. And it's literally about developing that two-way communication. It's about understanding your patients. So you should use this technique with each other as a team to clarify things so that your protocols, your systems, the way you do things are, completely clear to each other, and therefore the efficiency and effectivity will come into play. But also in understanding your patients' expectations, what they are doing there, what their solutions they're looking for, and why they have come to you. The more you figure out and go down that tunnel and figure out exactly what your patients want, that you will be able to provide the appropriate answers and appropriate solutions to those problems the patient has. And the more you can match that, the treatment you have, to the patient's real needs, the closer you're going to get to case acceptance. So active listening is about understanding before you are understood, which means talking to the patients and letting them have their say about everything and not rushing them, and then clarifying what you've actually understood. And you do this, literally, this technique, by asking open-ended questions. And open-ended questions are things like, how, where, why, what, when. And it actually not only clarifies, so when patients say something to you, ask them questions and summarize back to them what you've actually heard. And what you'll see is patients' body language changes. They'll literally start nodding to you, and their body language will start becoming a little bit more engaged and more interactive in the process, while you're talking to patients, which is what you actually want. And so when you hear something, repeat it back to them. Now, there's two forms of active listening. There's mini active listening, which is just repeating back to patients after you've heard, asked a few questions. And then you've got the big summary, main active listening, which is summarizing the whole thing back. This is a wonderful way of building trust and adding that value to patients, because suddenly they feel heard. When they feel heard, they'll suddenly start relaxing and, being in a situation where, now they are pre-engaged and they're receptive to what we're going to say to them. Without active listening, it's almost like they're going to feel rushed to say what they need to. They're not going to volunteer vital information to us, because that takes time. We don't know our patients, our patients don't know us. We're literally strangers to them, new patients. So, we need to sort of get into that situation where we actually engage with our patient. And active listening is an amazing technique to do that. So, once we've kind of understood the communication aspect of things, then we need to look at developing a sales process. Now, this is quite important, and it brings in lots of other aspects that we're talking about. Now, I use the word selling and sales frequently, and I have no ambiguity or no reservations of using this word. However, some people do, and I'm going to just clarify that a little bit. The only reason why people have this sort of stigma attached to the word selling and sales, especially when it comes to the medical profession, is because of all the negative connotations that are associated with this word out there in the world. And I'm not going to, sort of entertain that idea. Selling simply means developing a process or having a process of helping someone discover something of value, and therefore they're happy to pay for it. And, I'm going to assume we're all ethical in what we're doing, and talking, to our patients, because we want our patients to make the right decision for their mouth, for their health, and for their life. So, when I say the word selling, I literally mean ethical selling. I don't mean any other type of it. And that negative connotation is all our, difficult experiences we've actually had in the world by, a handful of bad people, so to speak. But that's not what I'm talking about. What I'm talking about is making a significant difference to people in their lives. And, when we do straighten teeth, when we do give back people their smile, when we do give them back themselves, their identity, sometimes that's what this is about. So, dentistry, what we are providing for patients is a lot more than just the dentistry, the clinical work that we're doing. We're actually helping people fill in holes that they might have in their lives. And it's much bigger than just, fixing teeth. I know when I was doing smile designs and, smile makeovers, it was so rewarding when I used to see patients for their recalls, or, years after I'd done the treatment, of how the transformations they'd actually made in their life, how the confidence that we actually give people, the self-esteem that we actually give patients. So, it's really important that we look at this in a very careful way of what we're actually doing. And that goes back to the psychological mindset that we need to have when it comes to gaining case acceptances, because we need to feel that we are there, doing serving a much bigger purpose. So, when it comes to designing a sales process, or becoming choice architects and designing that process in our practice, it's Invariably a communication process with added value of customer service and the experience patients have, and working on those emotions and making patients feel good in our practice. Now what will happen is sometimes they will get negative zings in their brain, which is any negative interaction that they might have. It might just be that the receptionist isn't smiling, or maybe the dentist has got their back to the patient when they're talking to the patient and not making them feel warm, and not resonating with the patient. So those can be negative zaps that they have in their brain. But we want to increase the number of positive interactions they have, and that's done through all the sensory systems, what we see, what we smell, what we taste, what we hear. If we hear two people arguing, or two people not talking to each other correctly, it suddenly makes us not feel very good in that environment. So we have to look at all these sensory systems that our patients have, and how they are experiencing our practice. And we have to work on them to make sure that they are positive, so that the patients feel that this is the place for me, and that we are start making the patients feel relaxed, start making them feel comfortable, start making them feel good. And more importantly, we start building that trust, and it takes time to actually build that trust. So we have to design this process to help us to do that, this communication process. Now, for ease of understanding and ease of teaching, I've actually split this into three parts. So you have everything that happens before a clinical examination. So I call that the pre-assessment. Then you've got the clinical assessment, the clinical examination itself, and then you've got everything that happens after you've diagnosed and treatment planned. Now, what tends to happen in most cases is that the pre-assessment is if you look at this triangle and the three components of this triangle, and the components represent the amount of effort, energy, time, an impact that we actually have on our patients. In most practices, the pre-assessment is maybe 5 minutes. So it might be literally 5-10 minutes on the phone, and the patient gets booked in straight away with the dentist. The clinical examination could be maybe half an hour or so, and then everything happens in that time. That's about 35 minutes to 45 minutes. Everything happens in there. So the patients are, where they're trying to understand us. We're trying to understand our patients. We're trying to build rapport. We're trying to engage our patients. We do the diagnosis. We do the clinical examination. We sit the patients up, we talk to them about different treatment options, and then we tell them this is the fee for your treatment plan. And because it's all condensed, and there's a lot of information that we've thrown at patients, that is quite difficult if we look at it, for patients to understand. We are expecting our patients to make a decision about going ahead. Now, what I teach is the opposite to that. So I flip this triangle on its head and teach that inverted triangle technique. And what I call this is opening with a close. So in any deal, a close is when the patient's made a decision that, yes, I want this, and paid for it, and then you're on the path to go ahead. So that's a close in a deal. But what we want to do is open with a close, which means we want to shift that decision making capability much more earlier, which means we can then put safety nets in the system as we go further through the system. And I believe 80% of the building the trust, adding the value, engaging the patient should be done before the clinical examination. Because if it's done before the clinical examination, when the patient actually comes to you in the clinical examination, they are going to be more pre-engaged. They're going to be open to ideas. They're going to have a better understanding. And then we support that in the clinical examination with our specific diagnosis and specific treatment planning, and go over everything again, which means patients will then be exposed to the information numerous times, which helps them understand this complex kind of dentistry. and they're more likely to say yes. So let's just go through these different aspects, and you know, I can explain what I mean by this. So in the pre-assessment, everything that happens before the clinical examination, this is predominantly about verbal skills. You know, talking to the patients in a certain way that engages them, that and helps them to understand and helps us to understand. So in the pre-assessment, it's about enhancing that patient perception. And usually it's done on the telephone and in a new patient consultation, if we can do. Now, new patient consultations doesn't, you know, I mean, I talk about sales processes and I help practices integrate this into their businesses, but it doesn't have to be just a treatment coordinator, you know, in that specific role. It's nice if you have one, but sometimes practices might not have a treatment coordinator, or they might not have consultation rooms. So we've got to adapt this. And new patient consultations can be done by either treatment coordinators or the dentist or the nurse. So you just have to work with the flexibility of what you have. The most important thing is the objective of what we're trying to achieve in the pre-assessment, and that is pre-engaging these patients and understanding our patients and helping them to understand what we're talking about. Now, these days, you have all these fancy tools and things that, you know, can help patients to see their teeth, and, you know, visual learning is really important. And, you know, a large proportion of the public learn visually, and, you know, are more receptive to visual cues. So, you know, having a scanner is really great because you can show patients their teeth and things. But also, you know, as well as having scanners and 3D scans of the photography is really good as well. Photography of the patient's mouth so that they can see the mouth, their teeth the way they are, and, you know, can help you to open conversation dialogue. But also, you know, having past cases that you've treated, you know, and showing patients before and after. By the way, none of these are my cases. You know, this is not something I've done, but they are Sure Smile cases. So, but the point is that it helps patients to see the treatment possibilities, and it's much easier to help them to make that decision to go ahead with these kind of treatments. Another part of the pre-assessment is understanding what's motivating patients. You know, what's their hot button? What has been their, you know, reasons for actually coming to see you? What's made them come to see you? Because again, these are nudges that you can have to bring them more towards making more informed and better decisions for themselves. And although I've listed 4 generic topics here, I think in the conversation, it's really great if you can delve a little bit more deeper into what precisely they mean by that. And by asking patients questions, you're actually, you know, giving them permission to say, talk to me, you know, tell me about what your history, your journey here, you know, how you've actually come to this situation, and, you know, what you're looking for, and what kind of things, you know, what kind of dental knowledge do you have, and what kind of things have appealed to you, you know, throughout your time. And then it's also to understand what stopped them. You know, if we don't figure out what has prevented patients to, you know, having this treatment be done before, then how are we going to fix what this obstacle patients have? You know, if we know about it, and if we know about it before we've even done the clinical examination, now we can actually help to overcome this. We can address these obstacles and therefore help to eliminate them. So it's really key to knowing this. And also, you know, knowing financial budgets, because there's no point, you know, if the patient's budget is very small, that we suddenly give patients these extravagant treatment plans. It's never going to match. However, if we keep the dialogue going, that we understand what their budget is, and then later on we can help them to afford that treatment, that's so much better in gaining case acceptance, because this can be one of the biggest barriers. So we can help to eliminate that by having this dialogue pre-clinical assessment. So the pre-assessment part of the process is really about discovering their problems, their needs, their obstacles, you know, really getting into their head and trying to figure out exactly what it is that they're looking for. Now, sometimes in fact, most of the time actually these days, patients come to you with preconceived treatment choices. So there might be other aligner treatment that patients have warmed to because perhaps their friends or family have had it, or perhaps the internet, they've come across it on the internet, they've seen advertising of it. And sometimes what patients tend to do is they self-diagnose and they say to themselves, right, this is the treatment I want. Let me see which practice does that. And then they go for it that way. But they've got these preconceived ideas in their mind. Now, if you say, excuse me, if you say to the patient, oh, that's not a good treatment, you should go for Sure Smile, then suddenly what you're going to do is you're going to build up these barriers and there's going to be antagonism there because this patient has fixed in their mind that this other aligner treatment is better for them, or this other treatment, veneers or whatever it happens to be, is much better for them. And if you suddenly say, that's not good, you should go for this, you're almost coming across quite salesy to them, and their intuition is going to say, well, hang on, this is what my research, because you're telling me that I don't know how to do my research, and I know, and that sort of thing. So that you take them down, you get their backs up and you take them down a negative spiral. So a better way of addressing this is when patients come in saying something like, they might mention a certain treatment, say to them something similar to this, that's a great treatment and it's had some amazing, success. It's got a great success rate. However, it's very much dependent on the appropriate case selection, and doing the right treatment in the right mouth is essential. Then you can go on to say, we like to remain cutting edge of dentistry. And so what we like to do is provide personalized treatment plans where we'll pick and choose the right type of treatment options to suit your specific situation. And this way we can ensure long lasting dentistry that's perfect for you. So we'll certainly keep this option in mind for you, seeing as that's something that appeals to you when we assess. But we'll also find other choices that may be more appropriate for you. Would that be okay? So by having a conversation like this, suddenly you're opening up the patient to be more receptive to other choices that might be better for them, without getting their backs up. So this is quite an important point, because a lot of patients you will see that will actually come in with these preconceived self-diagnosed ideas. So when you're talking to patients, it's really important this is a technique I call solution selling power questioning technique. Quite a bit of a mouthful. But it's basically asking questions of who, where, why, what, when, and the technique that I use is basically, these are open-ended questions that helps patients to open up. So rather than giving you one-word answers, and then you ask a few questions and then suddenly you jump to conclusions and start talking about the treatment, you want to pre-engage the patients and open up their mind and be more receptive. So if you ask a question such as, patients, what kind of solutions are you looking for, and the patient says something, then it's really good to say something like, tell me more about that, or can you expand on that? This way you're giving patients permission to open up to conversation. And by doing this, patients are going to be talking more and giving you exactly where, the mental journey that they've actually gone on as to why they've come to this conclusion that they want their teeth fixed. Now, another technique which is part of this is that you can talk about what's happening now. So there's questions like, when did you first notice the problem? Have you looked into possible treatments? Do you have a time scale? One really great question is, on a scale of 1 to 10, where are your teeth now? And, why do you think your teeth are at that situation? And this just opens up conversation for you, to give you information such as what the motivating factors are, what are obstacles for them. Um, And then you look at the past situation that they've had, what kind of things have happened in the past. Sometimes these are the obstacles for them, and why now? Why are they thinking about this treatment now? And then you can look at future goals as well. So this is conversations that you have. So if we do this, we are pre-engaging our patients. We're opening them up, we're understanding our patients, we're knowing exactly what their expectations are and also how we can exceed them. And then we move to clinical examination. Now, the clinical examination is predominantly about making patients feel part of the decision-making process. This is called co-discovery. If you just talk at the patient without making them feel part of the process, then you're not going to engage them. If you haven't mentally engaged your patients, then you're not really going to get the sales that you want because you're talking at your patients. Once the patient starts asking you questions about things, you know that you've engaged them. So when I'm doing the clinical examination, for ease of understanding, I split the examination up into 4 parts: the occlusion, the structural examination, the biological status, decay, infection, so on and so forth, and aesthetics. Now, one thing to remember here is that when we're talking about occlusion, when we're talking about structure, like, whether a filling is deteriorating or not, whether a tooth needs a crown or not, and when we're talking about infection, this is logic talk, right? So we're keeping patients on the logic side of it. So we have to have this balancing act in when we're designing this process, this sales process, to have more emotion and less of the logic, or enough logic and more emotion. However, the aesthetic part of the examination is the key here, because that's about emotion. And when we're talking about clear aligners, we're talking about straightening people's teeth. We're talking about improving smiles. So this is really key part where we can engage our patients by co-discovering with them what they like and what they don't like. We want to get the patients involved, want them to own the problem. And we also want to develop trust and value using techniques like active listening. And in fact, what we're trying to do is establish their clinical vision. What is it that they see in their mind's eye about their teeth? Now, one component of co-discovery is where your nurse is calling out questions. And I design all types of pro formas for this. But for example, with clear aligners, the nurse calls out questions. And then, as a dentist, while you are looking in the patient's mouth during the clinical examination, you look at that component and talk to the nurse. Now, what's happening is you're talking to the nurse. So, for example, if your nurse says things like, which teeth are tilted, or which teeth are rotated, which teeth are malpositioned, are the teeth straight, what level of crooked teeth are present. When the nurse is calling out these kind of things, and if you answer, yeah, this teeth is malpositioned, this tooth is, slightly rotated, this tooth is not correct, this tooth is getting a lot of forces and pressure on it because it's in the wrong position, this tooth is, get overly worn down, or got fracture lines in it. When you talk about these things whilst you are doing the clinical exam, you're engaging the patient, and they're hearing things and they're dying to ask you questions when you get up and when you sit them up. So, this is really important. Now, with clear aligners, the most amazing thing here is that you can, as part of your clinical examination, you can do a 3D scan. You can take photographs. If you need to take, if you've got a CBCT scan, then you can do that as well, and your treatment prescription, and you can send this to Sure Smile, and they will turn around a 3D image for you with no cost to the patient until they actually commit. So now we're removing financial barriers for the patient to go ahead with this. So you can integrate this into your clinical examination for all your patients that are somewhat interested in cosmetic improvements. And the good thing is, and I love this about this specific company, and that is that they can use STL files from any intraoral scanner, which is amazing because you don't then have to go and purchase a specific intraoral camera to be able to take these scans. And the other thing is that the registration of the scan data with patient photographs creates treatment that matches the facial anatomy and better suits the patient. So it's really great because you get these 3D digital models back which are biologically achievable treatment outcomes because it takes consideration of the whole route, especially if you've sent a CBCT scan in. And it's really good because the patient doesn't have to pay anything. So it's a no-brainer really to actually introduce this, idea and concept into your actual clinical exam, helping the patients to see what's possible. Now, I'm just going to take a little step back here in that if you are going ahead with clear aligners like Sure Smile, then it's really useful for you to have figured out exactly what the benefits of this treatment protocols is for patients. Because when you talk to patients, you need to talk in terms of how it's going to benefit them. And I'm going to run through a few benefits. Now, what you should do is, I mean, there must be more benefits than what I'm going to talk about right now. But what you should do is list all those benefits down, in your own time, and even better as a team. So with your reception, with your treatment coordinators, with your nurse, you the dentist, run through all the benefits of this particular clear aligner treatment, and then verbalize it. So put it in order of what the most potent ones are. So I don't know if you've ever experienced this, but sometimes when you've talked to somebody and then when you've left them, you think about it later and think, oh, why didn't I say that? Oh, I forgot to say that. That was so important. You will prevent that happening if you do this technique. So just run through all the benefits of the treatment and then put them in order of most important as a team, brainstorm this, and then verbalize it, role play this. So the benefits of these clear aligner treatments are, first of all, no impressions are needed. It's easy and comfortable appointments for patients because there's less refinements required and therefore less overall chairside time, which means, it's more convenient. The actual aligners are clearer. So, it's actual invisible treatment practically. They're more comfortable because of the laser cut smoothed edges and polished edges there. They're more discreet. You can have scalloped rim with less attachments. Patients get to see exactly the precise end results biologically derived beforehand with no financial commitment before visualizing the final result, which is fantastic. So therefore, there's no barriers to treatment and decisions. You get optimized results, biologically achievable, facially generated results. The treatment matches the natural anatomy of patients and it's cost effective as well compared to other aligners. And also they've got flexible pricing options. And then you also have clinical flexibility in your treatment planning, which is amazing. You've got things like Pontic points. So if you've got missing teeth, it covers that, number of aligners you choose, and so on and so forth. So these are some benefits that I've actually given to you, but it'd be really good if you can just sit down and go through all the benefits of this system. You see, you have to understand when you are looking at any protocol and you're trying to gain case acceptances of that. So in this case, we're talking about clear aligners. As dentists, you will have gone on the courses, you will have gone and understood exactly what this is all about. So for you, it might be easy. But if you don't organize your thoughts and do the pre-thinking involved here as to what to say first, what to say second, and the potency and the impact of the benefits to the patient, then you might get this slightly incorrect. So it might not be as impactful, the communication. But if you think about your team, the reception team, the treatment coordinators, the nurses, they might not have gone on those courses with you. And so they might not understand the full impact of what it is that you're actually doing. And it's really important because the rest of the team play more of a major role in the actual case acceptance process, that communication journey, and they're the ones that are supporting what you're actually doing and what you're saying. So it'd be really worthwhile just having that brainstorming role play that you do. So Then we move on to the post assessment. Now, if you've done everything correct, this should just be a formality and it should just run smoothly. If, however, this triangle is not quite the way you need it to be, with the percentages I've literally put there, and you might find at that point that you're having to sort of, use your safety nets and fill in those areas that might not have been addressed earlier. But the key here is to address these things beforehand. So the post assessment is really your case presentation. And there's two ways you can do this. You can actually present on the day. So if you've done most of the things that I've kind of spoke about, you might find the patient wants to go ahead with it. Having a scan of just the initial and not even seeing the final results is sometimes enough for the patient to say, yeah, let's go for it. If you've built the engagement, the trust, the value, the perceived value, you've done all that, sometimes that case acceptance can just go straight on that day. However, sometimes patients do want to see it. You've got the opportunity here where the 3D scan comes back of that biologically constructed end result, and you can book them in on another appointment. Now, there are 5 steps. These can get quite sophisticated, so I do customize this to each particular practice or each particular dentist. But for ease of understanding, I'm going to put 5 basic ones down here just to understand. So you've got, first of all, so you've done your diagnosis, you've done your clinical examination, and now you're presenting your treatment options. So there are 5 steps. Disclose findings, present the treatment options, then you do what I call a clinical closure, then you do a financial closure, and then you book the appointments and collect fees and so on and so forth. So let's just go through this. So the disclosure of the findings, I usually do according to those 4 aspects: biological, structural, occlusal, and aesthetics, with more emphasis on the aesthetics because that's what this treatment is fixing. And then you talk about the treatment options the patient has. Now, it's useful to say to the patient that there are many ways that we can create the end result for them, and talk about the different options, the advantages and disadvantages. So these are the basic options. So if we're looking at misaligned teeth, these are the basic options. And I'm going to teach you a technique that you can just practice. And it's a really powerful technique, kind of works on most cases. So the options are no treatment, restorative, which is veneers, porcelain, bracket and wire, fixed orthodontic systems, and clear aligners. Now, it's really important that you first figure out the order in which you're going to say your options. The other thing is the order in which you say the advantages of each choice and the disadvantages is also important. So don't talk about clear aligners first and then restorative and then bracket and wire. Talk about the most minimal treatment that you don't want, to the one that at the bottom, which is the one that you want to do. So you're here wanting to do clear aligners. So what you will do is the order we've got right, and then the way you talk about advantages and disadvantages. So I'm just going to do a simple demonstration so that you kind of understand what I'm talking about. I won't go into all the nitty-gritty, but just something simple so that you understand what I'm trying to say. So when you've got this order, but when you say the advantages and disadvantages, the way you say this is for the first 3 choices, you will talk about the advantages first and then the disadvantage. Advantage, disadvantage, advantage, disadvantage. When you get to aligners, you flip that around. You say disadvantage and then advantage. So I'm going to just do a little demonstration here. Okay, so you'll say to the patient something along these lines. So you say, so Sarah, the first choice is that we do no treatment, but from our previous conversation, I know that you're looking for some kind of solution. The second choice is we can do some restorative porcelain work. Now, with this, you can get amazing aesthetics, and we can create your perfect smile. However, we do have to do irreversible treatment by cutting the teeth, and this can damage your teeth in the long run, and you might need further treatment done down the line as well. So, that might not be appropriate for you. The other choice you have is bracket and wire systems. Now, these are good because we can do more precise treatment in certain areas clinically. However, they can be slightly uncomfortable. You might need more visits to the dentist. Cleaning becomes very difficult with food trapping, etc. So, that's that option. With clear aligners, now there is a little bit of an inconvenience, yes, with that. In fact, you might have to take them out, to eat, or that sort of thing. But I think it's minor in comparison to the advantages that you get with this system, because they're completely comfortable. You get amazing treatment. They're totally clear, and you get really natural, beautiful results. So you can see what I've done. I've talked about the advantage, disadvantage, advantage, disadvantage, advantage, disadvantage, and then I flipped it around. So I hope you kind of understand what I was doing there. But it's a really powerful technique, actually. Now, this technique should be actually done in the pre-assessment as well as the clinical examination, or the case presentation, the post-assessment. And so the options can be given by the treatment coordinator beforehand in exactly the similar way, but the treatment coordinator won't know which treatment you're sort of going to. And that's why the conversation needs to occur as to what the patient is actually looking for. So the treatment coordinator or the dentist in the new patient consultation can eliminate treatments that the patient's not looking for and make notes to that effect. And then it can be supported by the dentist, who will have done the clinical diagnosis, who will know precisely which treatment is going to be right for the patient. And then you do it in this way. And it's really important that this is done at least twice in the whole sales process. And the reason why this is done is because it's positive reinforcement. So the options given by the treatment coordinator is the patient's preferred treatment choice, figuring that out. The options given by the dentist is diagnosis dependent. And this is positive reinforcement. Also, with complex treatments like what dentistry actually is, it allows the patient to assimilate and to understand the information and to really embed that information. So you're taking them through this journey of becoming a choice architect, taking them through this journey so that they are increasing the perceived value, or we are increasing their perceived value, and they're having time to assimilate that information and understand what it is that we're actually talking about. If we just do this one time in the clinical examination, it's sometimes way too much, especially if we're talking about high fee-based treatment plans. It's sometimes too much for the patient. So this is positive reinforcement as we're taking patients through this journey. And then all you simply do is, for their preferred choice of treatment, it could be you just show them photographic or digital treatment journey, and that could be your 3D scan. Then what you do, once you've talked about the options, you've decided what options you're looking for, you do a clinical closure. That is a definitive where patients are choosing the clinical option that they want, that they feel comfortable with, and that they're happy with. So questions such as, is this the type of solution you're looking for? Do you have any other questions about the actual treatment? What you want to do is separate money from clinical treatment. If you merge those two together, which sometimes people do, it can be quite confusing as to know what they are at, what the obstacle actually is to the patient to going ahead with treatment. So I like to separate this. So if patients say, no, it's just about cost, now, if you've done everything right, you're probably given estimates to patient as you're going through the process anyway. So at this stage, there should be no surprises as to, how much the treatment is. The question you can say, if money wasn't a concern, is this the treatment you want to go for? And get a definitive for that. Then, once you've got the clinical closure, you do the financial closure and talk about the cost for the treatment plan, which will include the Sure Smile or the clear aligners. And then wait patient response, and then you go into financial discussion and talking about financial options. But remember, if you've done this right with the opening with a close technique, then you would have figured all this stuff out right at the beginning. So over here, it's just going to be a formality of moving forward and finding, and the paperwork involved with them finding a way forward. And then the final part of this is simply, asking, figuring out appointments, doing consents, etc., and moving through the process. So I hope that was like that I kind of gave a summary of the whole thing. So understanding patient expectations, using enhanced communication capabilities, and then developing that sales process. And there's so many different techniques that we could use in order to actually get that correct. Now, just as a side note, I do offer a whole host of online programs with or without coaching and mentoring. So do go to dentalwealthbuilder.com, if you want to find out more about that. I have case acceptance programs for dental practices, and associate programs that specifically works with individual dentists on this as well. So do go to that if you right, why is that coming down? If there are any questions that you want to ask me, then you can just visit my Instagram, drbhavnadoshi.com. Sorry, Dr. Bhavna Doshi, and can just DM me there, and I'll be happy to answer any of your questions. And then the other thing is, I really do support Sure Smile aligners. I really think it's the next big thing, because it's kind of addressed all the issues that were there with other types of aligners. And they have an amazing community. They if you haven't worked with them already, they give you so much support. They do in-person training, which is role specific, sort of reception separate, treatment coordinators separate, dentist separate. They've got online education platforms which are free of charge. And what they'll do is help you. They'll hold your hand through the process to give you confidence in doing these treatments, and communication, marketing, monitoring. It's just a fantastic community. So I really would sort of look into that. And I'm 100% behind this brand, because if I was practicing dentistry, I'd definitely be doing this, but I haven't been wet fingered for I think it's about 15 years now. But but I would do this. This is really, really great. So I'll just stop to answer any questions that you might have. So let me just go to stop this. Right. Any questions? Okay. Right. There is one question here, and that is, if you're an associate, how can you introduce this sort of sales process into it? And the answer to that is definitely yes. You can definitely introduce this process. You just do it within your surgery, And as an associate, you need to have some certain level of leadership skills as well to engage the rest of the team in what you're doing. And being conscientious of the fact that you might be introducing this new concept. You might have just had training done to it. Use Sure Smile and Dentsply Sirona. Use them to build that confidence and introduce things into the process, and just build. You can build the entire thing into your own patient journey, so you can have mini patient journeys within a practice. But obviously, it's much more beneficial if the entire team were involved. And one thing that I do is I train the entire team. So I'll do reception training, treatment coordinator training, new patient consultation training, clinical training, treatment planning, and case presentation. they'll all be, it's the same message, it's the same kind of philosophy and ideas and concepts throughout the entire practice. So the whole practice comes across in that perceived value to patients as a united effort. So so definitely, if you're an associate, this can definitely work. I've seen it in in so many ways that it's been effective. But the most important thing I would say is you just have to pre-work this out, work out the entire sales process, work out what you're going to say when. And the best way of doing this is brainstorming as a team, or you can get a group of dentists together and do some sort of role playing together, so that you can actually look at cases and figure out what to say and how to say it. So right, just one second. What are you? Right, so someone's asked here, what are your thoughts on patient questionnaires before initial assessment? Um, I think they're really great. I think it's fantastic, because what questionnaires really are is conversation openers, and if a patient ticks something that they are interested in or that bothers them. So I used to give smile questionnaires, and I used to say, on a scale of 1 to 10, does the aesthetics of your teeth bother you? Or are your teeth rotated? Does this bother you? These become what I call red flags. So when we collect those questionnaires in, it forms a communication point to discover and ask open-ended questions to, so that you can actually, talk more about this, because these are the red flags. These are the almost the hot buttons, if you like, of what patients are actually interested in. So yeah, definitely, the more questionnaires, I mean, don't make it silly, so don't make it pages on pages of questionnaire. We all know what that feels like when we have to fill out these forms for different companies and things. It's a chore, and we don't really want to do that. But a simple questionnaire. See, this goes back to your clinical vision, right? What kind of dentistry do you want to promote? What kind of dentistry do you want to do? What kind of dentistry do you really enjoy? And it is that dentistry which is what you're creating these questionnaires for. But make it simple so that it's easy for patients to answer. It could literally just be yes and no, so they don't, and then put room there if they want to volunteer more information. They want to sort of give you more impact. But definitely, new patient questionnaires are really, really good. Right, does anyone have any other questions regarding this? I know there's quite a lot that I've actually thrown at you there, but I always feel it's great to see that overall picture, so that you can sort of see in your mind's eye what you want to actually create. And then what I tend to do is break this down into its minor components, so that then we can work on these individual components. So I call this system that I talk about for sales and gaining case acceptance, I call it a multi-step, multi-layered process. And it sounds complicated, but it's actually common sense, really. And really, it goes back to how you want to be treated. I mean, when you go to an accountant, or I don't know why I keep going to a heart surgeon, but when you go to these specialists, you want to be treated that way. You want somebody to take their time to help you understand the information, to check on you with active listening, to make sure that you're understanding everything and they are understanding you, and that take you through that journey in a way where you have customer service, where you have a great experience, and then ultimately your sixth sense and your intuition and your gut will tell you that this is the right thing for you. And the way I see this is, for you might kind of just go on faith and go on trust. But if you think about it, if you've got any children, I've got 2 boys, but if you ever think about it, if you're trying to figure out a consultant for your children, suddenly you're looking at all sorts of things and your expectations kind of go through the roof, especially if you're going private. So you're looking at all sorts of things. And if these people do not meet those expectations, it can really irritate you, frustrate you, take you down onto the wrong path. So, if that happens, you've got all these defenses and barriers up. And the truth is, you just can't get case acceptance if a patient has all these barriers. So the process that we design needs to be a soft kind of process that's breaking down these barriers, small bit at a time. You'll never be able to do it all in one go because we don't know, we don't know each other, the patient and the practice. But by slowly sort of breaking down all these barriers, you can get achieve great results for both. It becomes a win-win situation. You get to do the dentistry that you love and enjoy. The patient gets to have long-term treatment, satisfaction, happy with the end result. And this is where you are exceeding their expectations. Um, Okay, right. So another question here is, are there any tips for increasing cases for existing patients? Yes, there's several. So when you're starting a new treatment or new to you that you've come across, like Sure Smile, then the first thing that you should do is let your existing patients know that you're doing it. And you can literally say that, oops, sorry, that's my watch. You could say to them that, you've had this advanced training, which is, giving you that capability of, giving more options, more advanced options, so that you can better care for your patients and provide them comprehensive care. And, would they be interested? Another way of doing this is doing an internal marketing campaign on your existing patients. And telling them that you're doing this kind of treatment. The good thing about Sure Smile is that you can do the scan and the prescription and that sort of thing. So if you use a questionnaire beforehand on all your existing patients, and they were red flags with this, and you had a conversation with this, then you can just do the scan, the 3D scan. And the great thing here is, remember, the platform is as such that it can take these STL files from any scanner. And I think they're introducing something new now, which is a mobile scanner, which is like just the head part of the scanner that's connected to a laptop that's been pre-formatted for this. And it's amazing because now, if you're an associate going to different practices, that's all you need. So look into that. Talk to the Sure Smile team about that. But it's just, it's amazing. I mean, when I think back to what I used to do as an associate, and and what things that are available now, it's just mind-boggling, literally. So yeah, so then, once you've done the questionnaire, got that red flag, just do the 3D scan, get the prescription done. And patients don't have to have any commitment until they see that final results. But because there's that visual stimulation, because there's that need, that internally, that they actually want this treatment, more likely you can get it. So I would definitely, if you're going through any treatments, yes, it's great for new patients, but also your existing patients should be able to take advantage of these new modern techniques that can just help them. Sometimes, right, patients want this treatment, but they don't even know that you're doing this treatment, or they might feel that your practice isn't about that treatment. And this happens quite a lot with general practices, where you're doing all sorts of dentistry, but patients might perceive that your practice isn't cosmetic, or your practice doesn't deal with this kind of orthodontic treatment, especially if there's no information, nobody's engaged them in any conversation about things that are available in your practice for them. And the worst thing that can happen is your existing patient then goes to another practice to get the treatment done, which you could have easily done. So that's one of the things. So definitely I would start an internal marketing campaign, start talking to your patients about this, and take advantage of what Sure Smile are offering in order to do this. Right, any more questions? Take advantage of me right now. um, right, doesn't seem to be any more. Okay, so As I mentioned, if you do later on think of some questions and you do want to me to answer that, then just DM me on Instagram. I'm more than happy to, I'm quite responsive on there, so I'm more than happy to answer any information. Other than that, I'd like to thank you sincerely for, choosing to spend your evening with me here today. I hope you had a lot of takeaways from that. So thank you so much. I'd also like to thank you, Densply Serona, for inviting me to this webinar today. I've really enjoyed myself, so thank you so much. And also to Dental Update for hosting this wonderful platform. So thank you so much and have a good evening all.